Welcome to the Mind and Heart Conversations series, where logic meets compassion in the world of medical sterilization. In today's episode, Mind and Heart will explore the critical differences between decontamination and cleaning, ensuring that reusable surgical instruments are safer for patient care. Episode 1: Decontamination versus cleaning. Both Mind and Heart agree on one fundamental principle. It is imperative to ensure reusable patient care surgical instruments are properly cleaned before the next use.
But how do we differentiate cleaning from decontamination?
According to the CRCST 8th edition, cleaning is the cornerstone of instrument reprocessing. Items that have not been cleaned properly cannot be disinfected or sterilized or made safe for patient use. Decontamination requires a combination of manual and mechanical cleaning processes. Therefore, the area will have equipment for both types of cleaning.
What precautions must be taken by healthcare personnel in the decontamination area?
Contaminated instruments and other medical devices are sources of microorganisms, to which personnel could be exposed through nicks, cuts, or abrasions in skin, or through contact with the mucous membranes of the eyes, nose, or mouth. PPE will minimize the potential for occupation exposure to blood-borne and other disease-producing organisms. Wearing heavy-duty, waterproof gloves while handling contaminated items decreases the potential for puncture, limits the microbial burden on hands, and decreases the risk of cross-contamination.
What is the guiding document which a CSST personnel should refer to choose cleaning and decontamination?
Manufacturers of reusable medical devices provide instructions about how to reprocess their devices between patient uses.
What should be looked out for when deciding cleaning agents?
Effective cleaning agents are non-abrasive, low foaming, free rinsing, biodegradable, non-toxic, effective on all types of soil, allow rapid soil dispersion.
Okay, how important is monitoring of temperature for cleaning multi-enzymatic detergents?
Water hardness, pH temperature, and the type of the soil present on patient use instruments impacts the effectiveness of the multi-enzymatic cleaning detergent. All multi-enzymatic detergents must be mixed as per the manufacturer's instructions for use. Cleaning solution must be changed frequently for maximum cleaning. Identify sink water levels to help ensure correct multi-enzymatic detergent dilution.
Is water considered a cleaning tool?
Although it is always taken for granted and not often considered to be a tool, water quality makes a huge difference in instruments' cleaning outcome. Poor quality water may impact performance of enzymatic detergents. It also affects the rinse phase by leaving deposits on items that have been cleaned. Purified water should be used for the final rinse.
What other cleaning tools must be considered while manual cleaning?
Brushes, cleaning clothes, sponges, water irrigators, and forced instrument air devices are considered while manual cleaning. Brushes used for cleaning usually have nylon bristles and are of varied diameters and length. Abrasive brushes should never be used because they scratch the surfaces of instruments and accelerates corrosion. Clothes and sponges should be changed regularly. Sponges cannot be cleaned, so it must be replaced at least daily.
Okay, we now know the basics of doing cleaning and decontamination. After all, we need to protect patients during their most critical moments.
Stay tuned for more insightful episodes of Mind and Heart Conversations, where logic and compassion come together to ensure the highest standards of medical safety and care.